the Advocacy Coordinator here at Crystal Stairs. The program has been around for quite some time. I want to say it's 16 years now. It's an advocacy program throughout LA County. Over the years, we've had over 2,000 advocates participate in our programming and in advocacy efforts for the organization and for themselves in the community. We've had over 1,000 advocacy workshops and training, over 250 partnership with community members, stakeholders, and different organizations. We've held over 100 meetings with elected officials where we discuss issues that pertain to childcare and issues that affect the families that we serve. We've had over 1,000 people attend and advocate at the Child Advocacy Day to champion for affordable and quality childcare and increase provider rates. And we also have had over 500 advocates and their family attend the LA County Stand for Children Day hosted by our CV program 3 years in a row. So essentially the CV program aims to educate. We aim to educate parents and give them tools to support needed to become advocates for their children. We also aim to advocate to raise the level of engagement with policymakers and experts in the childcare field. And we also aim to empower. We want to empower parents, our providers, and our families to make good decisions for themselves, but also advocate for themselves, their children, and their communities. Here, I'll briefly talk about some accomplishments from the CV program. CV joined with Parent Voices and the ECU Coalition in order to support a strong start for CalWORK's families. It was incorporated back in 2019, in the 2019 to 2020 budget. And now CalWORK Stage 1 families have 12-month eligibility. The CV program and statewide partner organizations, Parent Voices, engage in a 4-year campaign to earn 12-month eligibility for families receiving subsidized childcare. And lastly, Community Voices joined Crystal Stairs and 40 statewide organizations as part of the ECU Coalition, in which all organizations advocated for the same Billion for Babies budget proposal. So these are some of the things we've accomplished here in the CV program in the past years. Here are some pictures of providers, members, CV members who participated in different CV events. I believe this one is when they were going to Sacramento. Julia Ruedas, who used to be also a CV member, now is City School Board member. So that's something we also love to talk about and share. And she's been quite involved with the CV program and what Crystal Stairs does here. Next up. So in today's session, we'll hear from Senator Sydney Kamlager. We'll talk about current legislation that she's currently working on, and we'll talk about vaccine equity efforts. We also want to talk about everything that's related to equity at the state level. So before, we're going to do things a little differently today. Some of you may already know the senator. She's considered family here at Crystal Stairs. So I wanted to switch things up a bit, and we're actually going to have our CEO, Jackie B. Majors, introduce our speaker for today. Jackie, take it away.
Thank you, Monia. And yes, Senator Sydney Kamlager is Crystal Stairs royalty. So I could not miss the opportunity to come on and welcome her, not just because she's family, not just because she just celebrated a birthday, not because she was part of the founding of Community Voices, but simply because she's just an amazing friend and partner. And she has been such an incredible advocate for children and families. Even most recently in the Senate hearing, talking about AB 22, the importance of supporting our local family child care providers, our local child care centers with a mixed delivery system, and rate reform for our providers. As you all know, I won't get on my soapbox. Our childcare providers were the heroes during COVID and continue to be opening their doors to care for the children of essential workers, and rate reform ensuring a mixed delivery system that includes them is critical to not only acknowledging their value, but to keeping our system going and continuing parent choice. So Sydney has been amazing and awesome and wonderful. So yes, I asked the staff if I could join this time, and they indulged me and let me come on. And now I have to read your bio, Sydney, because I can't just, say that you're an amazing champion for children. And Isaac is, I think one of them is sitting in your old office. So your legacy truly, truly lives on. No, I have to, because we have some great partners. While I was listening to Monia and Isaac, I was scanning through. We've got a lot of friends on the call today. I see Dwayne Dennis out there. I see Gloria Davis. Yep, I see a lot of folks, and I'm so excited you guys are joining us. So for those of you who are new to this forum or do not know the amazing work of Senator Sydney Kamlager Dove, let me share with you. She represents, and she's my senator, by the way. She represents the 30th Senate District, which includes the diverse communities of Culver City, Ladera Heights. I can't even believe we didn't call out Baldwin Hills, which is where I live, Westmont, and Crenshaw, and downtown and Florence neighborhoods of Los Angeles. Elected to the California State Senate in March 2021 special election, Senator Kamlager has spent her career prioritizing equity and access for Californians, especially for Angelenos. She has authored landmark legislation in areas of criminal justice reform, healthcare equity, environmental protections, and affordable housing. All those things very important to us here in Los Angeles, including the most transformative probation reform law in the country and legislation requiring implicit bias training for healthcare professionals, law enforcement, and court employees. I'm just going to jump into your bio because we all know how important some of those last things that Senator Kamlager has worked on have affected us here in the Los Angeles community. And so we really appreciate that. She currently serves on the Appropriations, Budget and Fiscal Review, Governmental Organization, Human Services, Public Safety, and Rules Senate committees. She was that busy when she was working here too. So I'm sure if there's a door open and a seat vacant, she's going to sit in it. She is vice chair of the California Legislative Black Caucus and chair of the Los Angeles County Delegation, and has previously served as chair of the Assembly Select Committee on Incarcerated Women. Prior to being elected to the California State Assembly in 2018, Kamlager served as district director for California State Senator Holly J. Mitchell. I think some of us know her, while also serving as president of the Los Angeles Community College District, of where she became very good friends with my husband because he's at LA Trade Tech, trying to keep things moving forward there. She is a member of Zeta Phi Beta sorority and earned a BA in political science from USC and a master's in arts management and public policy from Carnegie Mellon University. Senator Kamlager lives in View Park, very close to me, with her husband, Austin Dove, her 2 stepchildren, and her dog and cat. We love you, Sydney. We're so glad that you're here. And to my friend, Senator Sydney Kamlager Dove, I welcome you to our Community Voices Forum today.
Well, thank you. That was an amazing bio. We should just stop right there because I'm just floating. But it's so good to see you, Jackie, and I hope that you and your family are safe. I hope that the Crystal Stairs family is staying safe. I know this is probably something we will discuss, but folks need to get vaccinated.
Okay. Thank you so much, Jackie. So Senator, it was so nice to meet you. This is my first time meeting you. I am new to the Crystal Stairs family. I was hoping we could just have a informal conversation about the items listed on the agenda that we discussed earlier this week. And I am going to flip things a bit, just because I think this issue is much more pressing, which you've already mentioned. I wanted us to start with talking about vaccine equity efforts that the state has worked on thus far, and talked about successes, challenges, and also discuss the vaccination rates among the demographics.
Yeah, so that's a lot. I don't want to, we could go on. I want to say 59% of folks in LA County have been vaccinated.
Okay.
40% have not. We are not at herd immunity. We started off very rocky, the state at least, regarding vaccine equity. If you recall, COVID hit and frontline workers, essential workers were hardest hit. Black and brown communities were not getting access to testing in ways that made sense, especially for those that were working non-traditional hours, people like our childcare providers who were taking care of the children of essential workers. The state jumped in with money and plans, purchasing beds, purchasing tests, eventually purchasing vaccines, contracting with community-based organizations to get the testing out, to get the vaccines out. It was rocky. Now, with all of this money and all of these resources out in the community, we are still not getting enough people vaccinated, which is why we are seeing the numbers go up.
Right.
The Delta variant is highly mutatable, highly infectious, and loves hosts. Our bodies are hosts. People who are vaccinated are getting it again, but they are not being hospitalized. People who are not vaccinated, who are getting it, are being hospitalized. We have a responsibility to the young people who are not getting vaccinated, who can't get vaccinated, our babies, to get vaccinated. And we have a responsibility to our elders who carry our history. I mean, we celebrate elders.
Right.
But we have a responsibility to them to keep them safe. Who's going to be, anyway, don't get me started. So you can go anywhere and get a vaccine, okay? Right. And I don't know what you need, if you need the tough love or if you need the love, but you need to just lean into whatever way you respond and go get the vaccine. You can get a haircut with a vaccine. You can get a gift card with a vaccine. You get an ice cream cone with a vaccine. You can get lottery tickets with a vaccine. I mean, we have so many incentives. So there's really no excuse except somebody's selfishness to not get a vaccine. You will not become impotent. You will not become infertile. Pregnant women, breastfeeding women can get vaccines. It is safe.
Thank you. Could you talk about, I know you mentioned that 49% of Los Angelinos have been vaccinated. In those numbers, can you talk about the rates in minorities, specifically Black and brown communities?
Yeah, well, Black and brown folks are 3 times as likely to not be vaccinated. 3 times as likely not to be vaccinated. And we have to ask ourselves why. Now we are discussing mandating essential workers, nurses and doctors, physicians to get vaccinated, state employees to get vaccinated if you are going to return to work. So before, I think it was an issue of not having access. Then I think it became an issue of not being able to ask questions of a trusted messenger to give you appropriate information on the vaccine. Now, like I said, I don't know what the excuse is, but given the fact that we have been at the front of the line with all of the disparity numbers, it doesn't make sense for us to give away our shot when it comes to the vaccine. So, before we were seeing like 70% not getting tested. That was in the days when we were trying to test people for the vaccine. And then as testing for COVID. And then with the vaccine, we saw, 65% of the folks that were showing up in Black and brown communities to get the vaccine were not from those communities. So then that's been addressed. But now the fact that, we're 3 times as likely not to go when you can just go to your pharmacy down the street is alarming. The state has been contracting with counties, with cities, with public health departments, local public health departments, with faith-based communities, with barbershops and beauty salons, pharmacies. So we have been doing our due diligence to make sure we are getting these vaccines into communities.
Thank you. My next question is still going to be vaccine related. I know you've talked about challenges with getting people vaccinated, getting people out there, but if any, I would also like to highlight maybe some successes with outrolling the vaccines, and where you see that the state has done really well or LA has done really well in terms of getting people vaccinated.
I think we have done enormous wonders around getting elderly, getting them to vaccination centers, pushing them to the front of the line. I know we were also very successful with making sure that frontline workers had access to the vaccine. So if they were people working on construction sites, doctors, nurses, teachers, bus drivers, those in the public sector, I think we have been very successful with reaching out to non-traditional outlets and contracting with promotoras and trusted messengers, going into the faith-based communities across all ethnicities and connecting with those groups as well. So we have seen, and let's be clear, before the Delta variant jumped in, we were being very successful with the rate at which folks were being vaccinated. I think the challenge just came with like the 4th of July and summertime, and people, we're all tired of being on the Zoom. And mixing folks who have been vaccinated with those who haven't been vaccinated, and then the masks. So, but before the summertime, we were having really good rates, and almost in the single digits with regards to hospitalization. So we know what we need to do. We just have to go back and be a little more diligent. Because we want to make it through the summer so we can get into the fall, truthfully, so that we can have a good start of the school year and move smoothly into the holiday season. I don't know about you, but I certainly want to have a Christmas dinner or a Thanksgiving dinner with my family and friends, people that I love. And I would love to be able to, at some point, get on a plane and go someplace for a vacation and not be worried about, COVID transmission. So a little deferred gratification will go a long way.
Right, absolutely. All right, thank you.
And I'm sorry, Monia, if I can just add, I know that my team is planning on sharing our mobile vaccination unit event coming up, I believe in August, later on today during our session. But can I just also call out to each of you? I see lots of Black and brown people on here. Each one teach one. I am making it my quest to talk to a lot of my African-American, connections, to talk to them about the real issues of trust and systemic racism that has built this fear in them. And it's important when you can talk to someone and they feel a connection with you. I have converted lots of people to the vaccine. I just say we all take ourselves from the leadership role that we sit in. For my brown friends on the phone, same thing. I think as you can reach out to your friends and those people that look like you and talk to them about your experience and your hope for their future and young children and their health. I think it's an important thing when it comes from you. But we are having a mobile vaccination unit in partnership with Supervisor Holly Mitchell, and a free Habit Burger will be coming with that. And
Kona Ice.
And meet with us. Isaac will talk about it later, but thanks for indulging me, you guys.
In 40, the state has administered 42 vaccination doses in the state. So that is pretty good. But these kinds of mobile clinics in your community coming to you make a difference. I know some older folks I've heard, we're excited about getting the vaccine because some of them survived the pandemic of 1918 and know what it's like. I think it's also really important that we wrap our heads around the fact that we may be wearing masks for a really long time, even after this is over. Because as our populations change, as the climate changes, as viruses continue to mutate and become, highly mutatable and efficient, we are going to have to respond. So this could look like a new version of normal. And it really is about how strong our public health infrastructure is, and how quickly we are able to adapt and be flexible to sort of community responses in order to really harness these kinds of infectious diseases that we could see in the future.
Yeah, absolutely. Before we move on to the next segment, I did have one vaccine related question. I think that was the only one that came in. Yes. And the question was, do you feel that we should continue using masks even if we're vaccinated in business? I'm assuming in the workplace.
So you know what? I have so many great shades of red lipstick that I love to wear. And it really gets messy when I put my mask on and it, just kind of bleeds out and I look a little crazy. But I would rather look crazy than be dead or on a respirator. So while I don't particularly like the masks because I wear glasses and there's this strange sort of, inhibiting thing that happens with having your nose covered and needing glasses and breathing into this mask.
Yeah.
I think we should consider this, and there are other countries that have been wearing masks for a really long time,
yeah.
Mostly because of health issues and because of the pollution that's in the air and the particulate matter. You should also think, how many of you all got sick? I didn't get a flu. I didn't catch the flu. I didn't catch a cold, all while I was masked up. So there are some incentives, but it's just like wearing a seatbelt. Way back in the day, people said, why do I have to wear this? And now it's synonymous with getting into the car and turning it on. So I think if you are vaccinated, you should be thinking about who else is in the room, and how to be thoughtful about their health, and allow someone to tell you, I'm vaxxed, you can take the mask off. I think when you're outside in public, it's okay to be maskless unless you enter into a space that's confined and there are a bunch of people. But now I just kind of have it with me all the time. And when I get a little nervous, I put it on.
Yeah, absolutely. Same here. Let's see. So we can move on to the next section of our conversation. And then I'll keep looking out for questions as they come up. But
also, because people lie, and sometimes they tell you they've been vaccinated and they haven't been. So if you don't trust these people, you need to keep your mask on.
Just put it on. So I wanted to kind of shift the conversation and still focus on equity and still discuss equity efforts at the state level. But one of the first questions I wanted to start on are if you could talk about your current sponsored legislations.
Oh, yes. 369 is a street medicine bill. This will allow street medicine providers to go out and get reimbursed for providing care to folks who are homeless. And I know Crystal Stairs and providers know all about wanting to get reimbursed for the work that you do. And so that is exactly what this bill does. So currently there are a number of street medicine teams. We have 28 in the state of California that go out and provide healthcare to folks who are unhoused. That's based on donations and contributions that they get. And many of these programs are affiliated with a school or a university. So this would allow them to get reimbursed through Medi-Cal. Folks who are homeless are already eligible for Medi-Cal. 70% of them are enrolled and have never gone to see a provider because you need ID. You know how it is when you're trying to call the doctor. Press 1. Wait. You leave a message, they'll call you back. What are you available this time? So all of those things which frustrate us, but we manage through, can be incredible barriers for folks who are homeless. So that's one. SB 679 is a housing bill. It's for LA County, and it would allow us to establish a regional housing authority to raise money to finance the construction of housing. Currently, we give money to cities, but also to counties, but mostly to cities. And you all know, based on where you all live, how much affordable and below market housing is being developed, not enough. And so this would harness the largesse of a region of Los Angeles to allow the entity to go after private and public funding. So it would be housing protection, tenant protection, new housing construction, and then preservation of current housing stock. And I'm really excited about this because I believe in equity, and rather than passing bills that give developers blank checks to come and be very predatory, especially in Black and brown undervalued communities, and take away our properties, because I'm still trying to get those 40 acres and that mule, then having an entity like this would actually allow community-based organizations and community land trusts to purchase and develop land into housing that is affordable, that would be affordable for folks to both rent and to buy. And then I'm doing some criminal justice bills. I have one to put due process back into our proceedings currently now. We have a gang database. 96% of the folks in the gang database are Black and brown. I do not believe that 96% of the gangs are Black and brown, but we seem to be the only ones in this database. And we have a system now where if you charge someone with a crime, you can say, I'm charging Isaac Cox with robbing a convenience store, and he's a gang member. And so currently all you have to do is present evidence about him robbing the convenience store, but you don't have to convince the jury that he's in a gang. And so I have a bill that would separate that out, because we know once you say gang, people get nervous and they start thinking about Training Day and Denzel Washington without the Oscar, and they get nervous and then they want to put everybody in prison. So those are three really big bills that I'm working on. But next year, I'm actually already thinking about one bill that I want to do that focuses on midwives and doulas and how we support folks that are interested in natural birthing and still have to have some relationship with our traditional healthcare system. There was something in the news that happened a few weeks ago about a young family that gave birth at home, and some madness ensued. And we just don't want that happening for our new mothers and fathers with their newborn babies.
Thank you for that, Senator. Any legislation in education or the ECE space?
Well, I had a number of meetings this year around ECE and the budget, but the Women's Caucus, we have a lot of women in the caucus, and everybody was hungry to take a portion of this. So I said, well, let me sit back and give folks the glory, but make sure that if they go sideways, that I sort of jump back into the situation and help people self-correct. So that did kind of happen with TK. And we were part of I was part of the holdout to make sure that we got the money that needed to be in to the budget for childcare, and that we were talking about rate reform. So that was important. But I'm always interested in ways that I can be helpful and to use my voice. But people were so, everyone wanted to do rate reform this year. So I was like, well, I don't need to be at the front of the podium. I just need to be making sure that everything is right when we start negotiating. But I definitely want to make sure that we are supporting our childcare providers, our licensed exempt, and our family childcare homes. I'm very invested in making sure that we are allowing our providers have access to equity and capital that they need to either expand their business or to shore it up. I recognize wholeheartedly that the majority of the providers are women and women of color and our small business owners. So I'm very interested in ECE from an economic space, right? Because my concern is that we will lose out. And we will lose out, childcare is actually it's becoming more and more similar to housing, where you used to have mom and pops that were running centers, and now things are becoming much more corporatized, probably because of the financing that's involved. And the state might not make things easy with all of the regulations. And so there are only, there are fewer and fewer entities and people that have the kind of capital that is needed to start centers up. So we have to make sure that we are supporting the mom and poppers, the moms mostly, more likely, who are in this business and who care about it. Because even when we were dealing with AB 22, I had for-profit private centers call, and they were corporate. And I thought, we're not trying to have no Blackstone child care center.
Right. All right. Okay. Thank you. Let's see. Next question. I know you mentioned your work within the ECE field and with the Women's Caucus. What are other equity needs / issues that the caucus is currently focusing on right now?
Well, we've been focusing a lot so decertification of police and qualified immunity, that's an equity issue because of the police misconduct and the violence that tends to happen mostly against Black and brown and men and women.
Okay.
We have been focusing on housing, so homeowner buyer programs, and going into communities of color, making sure that small businesses have access to capital through microloans, through work with our economic development corporations, through various tax incentives. We have been focusing on making sure that Black and brown folks and women are able to get onto corporate boards, mostly through sort of gender and race parity legislation. We were actually quite successful last year with this NCAA bill in the image and likeness. And so that is mostly because most of the athletes that are earning revenue for NCAA are Black men. And so we are certainly cashing in on their bodies. And so how can we sort of repay that? We have 2 members of the Legislative Black Caucus that sit on the Reparations Commission. And so that commission, that task force, is responsible for studying what reparations would look like for the state of California. We were focused very heavily on the issue around Bruce's Beach and returning that part of the beach in Huntington Beach to this Black family. It was stolen from them because that, 40 acres and that mule kicked in. So very grateful for getting that legislation passed and working with the county to make that happen. There are a number of things that we have been focused on. We have been watching LCFF, local control funding formulas, for our K through 12. I will say because of COVID, that has taken a back burner seat, but we are going to be revisiting that because just like healthcare, just like childcare, K through 12 education is incredibly important, and making sure that we don't suffer because of lost learning, it must be a priority.
Okay, absolutely. Next up is, can you talk about efforts to address the technology divide within Black and brown communities?
$5 billion this year, AB, I think it was 156, broadband for all. And I'm waiting for that money to go out so that my Zoom doesn't stop in the middle of a sentence. We have really poor infrastructure that needs to be addressed in rural areas and urban areas. And so we are going to be pushing, the state is actually getting into the game to push this money out the door, to make sure that we have the wires, that they are where they need to be, that they are connected, and that we are connecting or making sure that like the PUC, which is the commission for some of this oversight, has some authority to make sure that the providers are creating this connectivity. There are a lot of upgrades that need to happen, and we have good infrastructure and then spotty infrastructure. And so I'm very excited, but I also recognize, if you can believe it, $5 billion is still going to be just a down payment for a state this big. Yeah.
Okay. Okay. And actually, since we mentioned the technology divide, it was a question that came in, let's see, that asked that question specifically. What can be done to support free internet as part of the city's infrastructure?
Well, the cities are responsible for doing their own thing. But we are going to be pushing money out the door. And I will say there's so much money floating because of the federal stimulus dollars, a lot which has gone to cities and counties, as well as the support that the state is offering. So I can't speak. I mean, I represent 3 cities, LA, Culver City, and Inglewood. They all do things a little differently, but I think that's an important question to actually ask your city council person. What can I do to get free internet? We do have free internet at a lot of city or county facilities, like libraries and some parks. But that is a question to ask your city officials, how to make that happen. Maybe free Wi-Fi zones, making sure that all parks have it, metro if you're on a bus, so those things have been happening little incrementally. So I think somebody should be calling Mr. Bonin or Mr. Price or Mr. Ridley Thomas.
All right, duly noted. I wrote those names down. All right. Next question is, can you talk about efforts for pay equity for women of color?
Well, I'm still waiting for my full dollar. I'm about 25 cents away from it. Women's Caucus has been working on pay equity for a really long time for women. Right. But I will say, when we talk about women in pay equity, generally we're talking about white women. There is a gradation of women in that space. Native American women earn pennies to the dollar, along with African American women, API women, and Latino women. I think Latino women earn a few pennies more than African American, and then Native American women earn less than all of the women of color. So it's a struggle. We make resolutions every year. We talk about it. I think that was one of the reasons why we work to create gender equity on corporate boards and on boards and commissions that are, state boards and commissions, because we want to, create that kind of parity. Although, if you can believe it, those are now being challenged in court as being unconstitutional. And it is highly likely that the challenges will win. So it just goes to show you, actually, it's a lesson for the Women's Caucus to be a little more thoughtful about sort of the constitutionality and if things can hold up in court, because oftentimes when bills are passed, that's just the first hurdle. The second hurdle is making sure that they stand up in a court of law. So we still have a lot more work to do, but it's, and you can't make someone pay the same, because even if you do, right, which of course does happen, right, it's how much things cost, how much it costs for you as a Black or a brown woman to survive. So how far those dollars that you are earning go. And we know that they just don't go as far enough for us. Right. And it's also, how do we continue to talk about this in a way that changes the narrative and the framework for how we're valued. There's a reason why during COVID, 2 million women dropped out of the workforce. There's a reason why the ones that went back tended to be single and white. There's a reason why benefits like free childcare were not offered and have not been offered, through employers to families that need it, because sort of women and folks in the caring industry are not valued as much. And so, we have to just sort of continue to push the envelope to help people understand that. Now, I will say everybody understood childcare because we was all at home on the Zoom,
Right.
with the babies in the one room and us in the other. And it was like, this is some madness.
Insane, right.
So then that's when you realize how important childcare is.
Absolutely. Yeah, that's so true. One question came earlier that kind of relates to this. Someone asked, how are you helping parents that have full-time jobs who are expected to go back to work full-time? I'm going to assume that it's based on, if I have to work full-time, how do I care for my child at home?
Right. Well, so I don't know how you care for the child at home if you're working, if you don't have access to childcare. I mean, we worked on a multi-billion-dollar budget ask this year that worked on rate reform, the standard reimbursement rate, the regional market rate, that gave greater incentives, that increased slots. We did a lot. And all of that is with the intention of making it easier for parents to go back to work and know that there is a space available for their child. So I think that's how we're making it easier. There's always more that we should be doing, especially sort of as times evolve. But I think that was a huge thing. And that was something that we've been fighting for a very, very, very long time.
Yeah. All right, let's see.
But we need to make sure that providers don't go out of business. I mean, that's how you make it easier. You make sure that you have, to Jackie's point, a mixed delivery system where the choices are equal. You're paying the same for X as you are for Y, that we're not like shuttling people only down one path.
Right.
Really making it more difficult for folks to get the kind of childcare that is most appropriate for their family. And that's something that we have to continue to do. I think folks remember a time, Jackie remembers this, I'm sure, when there was a fight about, what kind of provider was qualified. If it was, you had to have a BA, that was more important than having lived experience. I don't know about you all, but I have run into, and I don't want to offend anyone here, but I've run into a whole bunch of folks that just got out of school and they've been out of school for 6 months and they think they know everything about the issue.
Child development, yeah.
And then, there's somebody in the corner that's been working in that space for years and years and years. And, so I think we should not be offering these binary choices because that's not what parents deserve.
Right, absolutely. Let's see, I got one more question. Are there any incentives in place for business who can do so, in parentheses, for working remotely to reduce pollution and traffic?
So the state isn't necessarily asking folks to, those are decisions that businesses have to answer for themselves, because what kind of business you are, who your clientele is, how many staff you have working for you. I don't think you want you don't want the state in the weeds of your business like that. But we have offered incentives for businesses that have stayed open. We've offered tax credits. We're offering tax credit incentives actually for folks who are hiring folks who are formerly homeless or who are currently homeless. We have worked to make sure that incentive checks go out. We have lowered the threshold for getting access to capital. So all of those things, we have put money towards technical assistance to help businesses kind of reimagine how they need to work because of COVID. We have paid for PPE. So all of those things we have done as a state. The business is responsible for deciding who can work remotely, and how many staff they're able to keep, and if that makes sense. So I certainly think we need to do all we can to reduce pollution and traffic. But part of that is get on the bus or carpool with somebody or walk down to the street to get the snow cone instead of driving. So those aren't things you necessarily want the state deciding for you.
All right. Let's see. So next question. And we're about to wrap things up in a little bit. Are there any community engagement efforts you would like to share that you're currently working on within South LA?
I have an urban farming initiative, and we are trying to create urban farms across the district so that people can grow the food that they eat and share it. So I'm very excited about that. I'm actually also working with the group in Leimert Park to establish green jobs. I think it's great that we have electric vehicles, but if we are not helping to create the green energy, then stop asking us to buy the green energy. So I have been working with a couple of nonprofits to create some training facilities and incubators here in South LA. So those are two big things.
Okay, awesome, thank you. And then this is something I started doing to allow my speakers to share any achievements or success stories before we wrap up.
Well, you know, I think my biggest success story is I have 3 stepkids. One of them is in college now, but I have 2. One is 17 and one is 14. And the 17-year-old got her first job, got her driver's license over the summer, and she's like really excited about going to college. And it is looking like she will get into many of the ones that she is hoping to get into. And I have a 14-year-old who all of a sudden blossomed into this young man who is really about service and exercise and discipline and learning new things and expanding his horizons. And he's so interested in new friends and having friends that want to dream with him about the possibilities of a brighter, better future. And so those have been my successes, seeing these young folks that I've helped co-parent blossom into these young individuals that are vibrant and thoughtful and provocative.
Okay, awesome. Thank you for sharing that. Let's see. We're going to wrap up. I'm just double checking for
I also lost some weight.
Yay. That's hard work. That really is hard work.
Let me tell you, I was like opening the refrigerator and just staring in and like for days, but I had to get back into shape. I said I have to get into shape.
Baby steps. That's what I tell myself. It doesn't always work, but that's what I do. All right. Let's see. Well, thank you so much, Senator. Before we wrap up, we have last few announcements. So I am going to let Isaac take it away. Go ahead, Isaac.
All right. So thank you guys again for talking about the vaccination at the beginning of the Lunch and Learn. This is, again, such a timely issue. We do have this event coming up on Saturday, August 7th. This is our COVID-19 mobile vaccination clinic. We are partnering up with Total Testing Solutions. They are the guys behind getting the doctors and nurses, early education workers. They got all of them vaccinated. These people are pros, and they have offered their support and are offering Pfizer and Johnson & Johnson, your choice, whichever you feel most comfortable with. They will have those shots ready at our site on Saturday, August 7th from 9:30 to 1:00 p.m. We also have Supervisor Holly J. Mitchell, who will be giving an open address at the beginning of the event at 9:30. So show up early. She'll be dabbing some elbows at you guys. For those that get vaccinated, we'll be offering Habit Burger, Kona shaved ice. We'll have food produce. We're even doing a bunch of giveaways. We have some exciting items that we're going to give away. So we just have so much fun things planned for this event. But really, it all just goes back to to supporting our community, protecting our community, and getting people vaccinated, right? It's literally, it's a huge issue. Did any of you guys, did you guys know that over 4 million lives have been lost due specifically to COVID across this world? Like, sharing this event with your neighbor who hasn't been vaccinated literally could save their lives. So I would love to just, you know, equip you all, and can I make you all advocates? Can you go out and share this information with your colleagues, with your family members that aren't vaccinated? Because what you do, what you share with them could potentially save their life. So come on, join us for this event. Register now. We got a little bit.ly link there, bit.ly/CSIMVCE. Those are the acronyms for Crystal Stairs Inc. Mobile Vaccination Clinic Event. We will be doing the first doses. Just bring any form of ID, whether it's a school ID, work ID, your driver's license, whatever works. And we're taking minors too. The Pfizer shot is okay for ages 12 and older. So you can bring children. We do need more specific identification for those younger individuals. If they are under the age, if they appear to be under the age of 18, the nurses at Total Testing Solutions will require a birth certificate, because again, they're not going to give a shot to someone that is under the age of 12. So they need to verify that. And again, we're going to have a very safe event. Everyone will be wearing masks at the event to, again, just keep the safety and prevent any flow of any viruses. So we hope to see you all. Please, I will also paste that into the chat so that you can click on the link and go directly there, because I know a bunch of you guys are going to click on this link once I send it and sign up today, right? It's gonna happen. So that's all I have for the events. Take it away, Monia.
Thank you everyone again for attending our Lunch and Learn, and thank you again, Senator Kamlager, for coming to speak with us. It was very interesting to hear your insight on all these things and hearing about the work that you do for your community and the families that you serve. So thank you very much.
Thank you for the invitation. I hope it wasn't too dull and
not at all. It was riveting.
And family and friendly faces. So
yeah. Thank you so much, everyone. Have a great afternoon.
Thank you.